Hi, I'm Philip Jackson-Taft, lead nurse at OH1. Welcome to this second part of our presentation about managing health through the COVID-19 pandemic. These sessions are part of our series of webinars looking at health difficulties facing the working population and new ways to think about the management of health symptoms. As a nurse, it is my job to support people to live well whilst they experience health challenges. The changes to our lives caused by the pandemic are causing difficulty and challenges for everybody. Hopefully, by producing these webinars, OH1 can help in some way to make the experience easier. In this second presentation, Dr. Batman offers some insight and practical advice about how businesses, parents, families and all people can actually improve their health and well-being despite the pandemic, and they can learn to thrive in this difficult time. Thanks once more for joining us. Here is Dr. Batman.
So let's talk about how we can improve your resilience mentally and physically, help you get through this and help you get through whatever period of time we're going to. Now, something that I say to everybody and something that I live by: if you can't change your circumstances, change your attitude. Because a lot of this is about how you think, and how you think will structure your attitudes and your behaviours. So we've all got to accept we're going through a period of anxiety. You can stand there and worry about it, worry's not going to change anything. Let's change our attitude and try and be more positive. Let's not just look for problems, let's try and seek solutions. You can't find a problem to treatment of the virus or a vaccine, I can't. But we can look at the little problems around us and try and solve those and try and look after ourselves, and by looking after ourselves, we look after everybody else. So I'm going to go through a number of regions. I'm just going to go back, I just quickly hit the wrong button there. So I'm going to go through these areas about improving your resilience. So we'll go through each of those individually, and hopefully when you come out of it, I don't want you to remember all of this. I want you to remember bits that you think that you can change, which will change your attitudes and help you get through your circumstances. So let's look at the generic advice that I'm going to give you, that I give everybody who I talk to. I go right back to my opening statements. Remain positive. The majority of this, and I mean something like 98% of the population, are going to get through it. Unfortunately, we are going to have some deaths, and we're going to have tens of thousands of deaths, and each of those deaths has got relatives at the same time. And it's a tragedy for them, and I feel the sorrow and the sympathy that they're going to have and to get through that. But for most of us, we will come out of the other side. I'll go with that, and I'm going to keep saying that. If you can't change your circumstances, look at it in a different way. Try and think of it something simple. Yes, you're isolated, you're locked down, but you haven't lost your freedom. You've gained time. Just think of all that time you spent commuting, going to work, the amount of time you'd stop off and buy another coffee, a sandwich. It was wasted time. You've now got that time to spend wisely. So the solution is spend more time with your family, your partner, your spouse, whoever you can. And that doesn't necessarily mean face-to-face. Use social media in terms of Skype, FaceTime, Zoom, have family Zoom meetings. I do. It all helps. And for men in particular, now is the time to spend more time with your kids and get to know them better. So it isn't lost freedom, it's gained time. Don't become a swan. Open and honest and talk about your feelings. Don't hide them, please. Do not become the elephant in the room. If you do have existing medical conditions which can be a risk, stop your smoking, less irritant going into your lungs. If you are overweight, I know it's difficult to exercise, watch what you eat, try and lose some weight because there's less pressure if you did need to go in hospital, pressing down on your lungs. If you have a medical condition, if you're diabetic, make sure it's controlled. If you're on medications for asthma or lung disorders, make sure you take it regularly. Look after yourself and make sure you do that on a regular basis. Social distance, and in terms of social distancing, we're all standing 6 feet apart, 2 meters from people. But I'm also saying distance yourself from the media, and social media in particular. I feel so much better by not looking. I don't look at the news in any shape or format at 6 o'clock in the evening. I don't look at it during the day because it's not going to shape my attitudes, my beliefs, the way I carry on with my life. So don't keep looking at the negativity of the news. Once a day is enough, and even that might be too much. But also a bit more in social distancing. Social distance yourself a bit from your fridge, from your alcohol, substances of abuse, etc. They're not helping you as well at the same time. And clearly there's this idea about, well, I'm going to snack eating, I'm going to graze, etc. Just try not to. If you, we all like a drop of alcohol. I'm not against it at all. Maybe try and just keep 2 days free when you're not using it and have something else in its place. That will help you physically and mentally as we go through this crisis and into the next stage of your life. Set routines. You used to get up, get washed, get dressed, quick snack for your breakfast probably, and off to work, and same at the end of the day. Set some new routines. Still get up at the same time, but the new routine is have breakfast with your spouse, and if you've got children, with the children. Talk about what you're going to do with the day. Set your routines if you're going to work. Explain to other people in the household your time for work, that you don't want to be disturbed, but then set time for other things as well, work and play. Do not let work become your totality. It's too easy to drift from home working. Set yourself a separate room, set yourself a workspace, talk to colleagues, etc. But manage that time. Don't let it drift. Communicate, communicate, communicate. The gist of this. Those in your home, your neighbours, your friends, use Zoom for family meetings, etc. But keep talking and keep communicating. Even the simple things matter. Maybe what you're feeling now, and just think about it. If you've got elderly relatives, either in their own homes or in care homes, etc., this is what they felt like all along. They felt isolated and lack of communication in the past. So maybe some good will come out of this, and maybe you'll treat those relatives in a different way long term. Stay connected with your manager, with colleagues, family and friends. It's vitally important. And finally, I will say is watch those email communications. What you think you are saying and what you mean in that email that you are writing may be interpreted differently by somebody else at the other end. I'm seeing a lot of problems coming out of email communications, particularly between teams, etc. Far better if you keep what you want to talk about from a team point of view and have it through a meeting. So that's the general advice that I will give everybody under any circumstances. So I'm now going to talk about your physical health. I know mainly the issues I've been talking here have been mental and psychological health, but let's talk about physical health. I don't talk actually about physical and mental health. I don't separate it. I talk about health. Because whether you are talking about your physical problems or your mental problems, lifestyle is 70 to 80% of your risk. So the risk factors, the solutions, the causes are exactly the same. Exercise. Now, you can get out and you can walk once a day. Those of you who are lucky enough to have parks and fields and things around to go to, get out there and do it with your kids. If you can't exercise there, do it in your own home as best you can. There are lots of really good exercise videos, programs out there, but exercise is vital for physical and mental health. Keep to your usual sleep patterns. It's too easy to stay up late to watch the TV and then get up late. Your body works by rhythms, circadian rhythms. Those rhythms depend on sleep. Hopefully between 8 hours if you can, somewhere between 7 and 9 is ideal, but keep that sleep pattern going, because sleep isn't just about having a rest. It controls a lot of the other body rhythms as well. I've talked about avoiding the newscasts, and in particular, avoid one for at least 2 hours before you go to sleep. Some of the last things that go through your mind in terms of your thoughts and your visibility and what you've been thinking go into your subconscious at night and disturb your sleep. So no newscasts. Try and avoid social media as well, the negativity, a couple of hours before beds. Keep active if you can. Get those jobs done around your home or garden if you have one, the jobs that you kept with. Play with your kids. Vital. Your kids need you. Children are vitally important. They're locked up as well. They're isolated. They don't understand why they can't see their friends and their colleagues, etc. I know it's daft. I said, dance in the kitchen, have your own disco, have fun with the family. Fun can still be had, even in difficult times. I've got people and videos of families doing stupid things in their own homes. You're allowed to do that. Eat normally, regular meals, keep your body going. And also, you've got that time to have breakfast together, the evening meal together, etc. Talk, take the TV off, take the laptops, the tablets off, and talk to one another. Play games as well at the same time. So that's all about physical health. Now, managing your mental health, some of the things I'm going to talk about here are exactly the same. As I said, I don't differentiate between the two, but I've put in bold, in bigger fonts, avoid news and media excess. I've said once a day. It's exercise, it's sleep. And in the middle of that, you'll see something I've called my attitude of gratitude. I find this extremely successful in years and years when I've been helping people through psychological problems. We all tend to dwell on the things that have gone wrong in the day. Doesn't matter where it's been, whether it's work or home, kids, spouse, family, etc. If you actually, when you go to bed, think about the 3 to 5 things that went well that day, things that you are grateful for. It may just be a nice walk with your spouse or even yourself in some warm, fresh air out in the sun. It may be a book that you read. It may be a piece of work that you sent off. It may be something your kids said. So think about those things before you go to bed. And the other thing, if you are in a relationship and you're in the same household, the two of you just discuss 3 things which went well to have your attitude of gratitude. So you're moving that negativity into positivity before you go to bed. I've said communicate with family members. And one of the things I've done there is that, when you're managing your kids, and I'll talk about in a minute, you can still talk to your parents and the children can still talk to their grandparents and they become virtual babysitters, etc. Don't be negative and do the things that you enjoy, etc. And I've put in there about managing your thoughts, but a lot of this is about attitudes and thoughts. And I'm going to talk a little bit about mindfulness, a form of relaxation, a form of meditation in a minute. So those are the things that you can do for managing your mental health. So now I'm going to talk a bit about mindfulness and mental health. And invariably when I see problems, the first problems ever, it starts with a thought. And my mental health webinars like this one are always starting with, it started with a thought. The average person, and everybody on this webinar, I'm including as an average person, you have between 30 and 50,000 thoughts a day, huge number of thoughts. It may well be that carpet's grey, what am I going to have for my tea, or what that manager should have, etc. But most of the thoughts that we have, in fact, are negative. 80% are negative. 90% of the consultations I have when people are depressed, anxious, etc., it just started with a single thought, went into their head, the thought became a story, which became a self-fulfilling prophecy. And a lot of time, most of those thoughts were actually not true. They were made up in people's minds. But once those thoughts, particularly negative ones, start to dominate you, you don't sleep properly. And with that lack of sleep, you get fatigued, you lose concentration, your memory goes, etc. And that it's like a snowball rolling down a hill. It just gets worse and worse. So share those thoughts, share those worries, share those concerns, partner, colleague, friend, work, etc. Often it's just by writing them down. You dispel them out of your mind at the same time. But again, try not to have negativity. Try and solve the problem rather than doing that. Try and create new skills and do things in a different way. Couple of simple things that you can do which will make a difference. We all go to the same dominant hand when we brush our teeth. Now, this is going to seem daft, but this makes a difference. There's a science behind this. If you actually just use your alternate hand to actually brush your teeth and try it, it's quite difficult. And what's happening there is your mind is being distracted. You're doing it in a different way. And if you do that several times a week, you're actually disturbing your thought process and makes a huge difference. If you go out for a walk, go out for a different pattern each time. Don't walk the same way and look up, not down. You'll see different things to look at. I practice mindfulness. Now, mindfulness is a form of meditation. It's not the cross-legged and sit and chant on the floor. It can be quite difficult to do, but I practice it every day, 15 minutes every day, to clear those thoughts in my mind. In between my consultations with patients, I do 1 to 2 minutes mindfulness at the same time. It's not dispelling those thoughts, it's some breathing techniques, it's help. So if you're having difficulty with your thoughts and they're gloomy, just look up something like mindfulness. There's some good books around and there's some really good apps. So put an app on your phone or your tablet, etc., and go from there. Excuse me. Come back. If you can't change your circumstances, change your attitude. That's a thought process. And at the end, a famous saying that I've used for many a time, and I use it in my presentation. This is at the end of my business email address. And what it says, it will be all right in the end. If it's not all right, then it's not the end. And that's very applicable to now. We're in the early stage of this pandemic. We're getting to a peak, etc. It will be okay in the end for most of us. It started out as a Hebrew saying a couple of centuries BC, but the most famous person that got it from was John Lennon. So remember that, and we will get through it, and it will be okay. So working from home. What are you going to do about working from home? That's become the new norm. This is enforced now with social isolation with most of us. So it's alien. We've always done a bit from home, but never on a regular basis. So just like going to the office, set regular times when you're going to do office work and when you're going to have homework. Make sure that you work it and you've planned it, etc. You've agreed that plan with your family members so that you're going to a place of work. It may be office, it may be a lounge, it may be the dining room, wherever it is. And just make it known to your partner, your spouse, your children, that that's a period of quiet for you, that you need to do it. When you get up, dress differently. It doesn't have to be your work clothes, but something different. So you've got this differentiation between work and home and relaxation. So dress and change your attire a couple of times a day from work and home. It breaks up the day, and it also shows to your partner, your children, which frame of mind you're in, which mode you're in. Take breaks. Don't try and keep going and going and going. What's happening with a lot of people, and managers are not good at delegating this, saying we expect the same amount of work done in those same hours, that all because you're at home. You're not just at home. You've got distractions from your children, everything else that's going on. So you're going to have to take some breaks as well at the same time, and take regular breaks to break up it all and help your concentration. Make sure you've got the appropriate technology and the right technology for doing your job, and that's agreed with your business. Communicate regularly with your manager and colleagues. And I'll say it again, please take care with those emails. And it's just not just the message, it's the font that you use, it's the color that you use, it's the amount of time that you're taking. Please do not be thinking, because hang on, I can spend a bit more time. I don't have a spouse, I don't have a partner, I don't have children, therefore I can work late at night, and I'm going to bang off those emails 11 at night, 1 o'clock in the morning. Please think about the person who's going to be receiving them. Because if you do that on a regular basis, your people, particularly if you're a manager, the people who work for you will be going to bed at night thinking, I've cleared my inbox today, but oh, Joe or Joan or Sue or Fred, they're going to be up late at night. I'm going to be waking up. I'm going to be bombarded with emails. Please think about the people who are recipients, not just you sending it off. Communicate, 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 and understand other people. If you've not got children, believe you me, it will be really hard for you to understand the implications of having children under your feet all the time. So family life has changed, hasn't it? You're isolated, you're locked in. It's almost a prison for some people. You're having to educate your children as well at the same time. Again, this is about regular communication. It's about voicing your fears. It's about saying to your partner and your kids, how are you today? What are you thinking about? What's worrying you? Let's talk about it. And don't do it glibly and dismissive. You need to find that time to have those. You know, if you're both working, you and your partner, you and your spouse, split the responsibilities. So you know which one of you is working and you know which one of you is looking after the kids as well at the same time. But do expect and accept there's going to be disruptions. Try and avoid criticizing those in your household. They can't do it, particularly for kids. They don't understand what's going on. And it's difficult with this. Accept some criticism. Don't be as hard-walled. And I come back to the generations. Some generations are better at accepting criticisms than others. Enjoy the time with your kids, dads. You know, you're going to get more time with your kids than ever before. It's fun. You will come out of this even better and stronger relationships. I said there, set up virtual babysitters. I've actually seen and heard of, and a number of managers telling me, they've got grandparents out there. And the grandparents will get on the tablet or the laptop with their children and read them a story or play a game with them. And you can have them as virtual babysitters. There's no reason why you can't do that. You can also getting your children still talking to their friends on their laptops. You're going to have to be a little bit more free and easy on their media time. And I know we all try and distance ourselves from our kids. We don't want them there on their games and all the rest of it, but use it so that they can maintain their relationship with friends at the same time. a bit more relaxed with it. Take walks together. And again, reward good behaviours. It's the opposite of taking that criticism. If they do something well, give them praise, even if it's a little thing. Those little things in terms of your children's attitudes of gratitude will change. And again, be creative. Let go, be less rigid. The disco, special meals, allow treats. There's no reason why, you can't have fridge challenges. One or either of you, whatever, go to the fridge. We'll make a meal about whatever we can get there. You see it on the TV, try it there and do it the same thing. You and your partner, take it in turns to cook or learn to cook together. You've probably not done it before if you didn't have the time. Learn to cook together. Create a special meals. Yes, you can't go out to the restaurant. There's nothing to stop you both getting dressed up and having a meal together, a special meal, what you enjoy. Open a bottle of wine and make an evening of it. Allow treats to creep into it. You've got to make a differentiation between day to day. Suddenly, Monday to Friday is the same as the weekend, etc. One day is the same as the rest. So break it up. If you can do it, be inventive, be creative, make something happen. And maybe this becomes the new norm. Now then, managers, what can you do as a manager? You're vital in this, and I think going forward, the manager, they've always been important to me, but now the manager is going to be more and more important than ever. Keep connected with your staff on a regular basis. Yes, you're going to have team meetings, and that's vitally important. Zoom is good for that, and the other forms of technology we've got, because everybody's there. But those meetings need to be managed. The agenda needs to be structured. You can't have the same agendas as you've had before. Be more flexible on the outputs and the targets. What you had, what your roadmap was like, what your KPIs were like, what your strategy was like at the beginning of this year is now radically changed. You need to revise that, you need to communicate it, you need to agree it, you need to set individual responsibilities, put some flexibility. Now then, those are the mass meetings. If you can, depending on the size of your team, try and have once, twice a week if you can, one-to-one meetings with each of your team. Don't just listen to the words that are coming out of their mouths. Look at their body language, look at their facial expression, see how they really are. Are they struggling? Do they need extra help? Everybody say, I'm okay, I'm fine. They may well be not. Look at other things. You may have to ask different questions, not how are you, how's the work going, have you hit your targets? Just ask some simple questions and tease it out of them. How is life at home? How are your kids? If the kids come into shot, ask about the children, etc. Be a little bit more relaxed, be more flexible. What you build into your teams and individuals now, you will reap the rewards of when this goes back to it. I work as well, I said at the beginning, I'm a member of the Science Advisory Board for Virgin Pulse. The lead and founder there, Richard Branson, has a very good saying, which says, if you look after your employees, they'll look after your business. So whatever you do to help your employees, you will reap the rewards later on. It's going to be tough as a manager, but you need to go and ask, how are you? But above all, as a manager, look after yourself. Please don't neglect yourself physically, mentally, socially, etc. You are vital to the network. You're going to be more vital going forward. And again, find somebody that you can discuss in confidence your worries, your concerns personally. You're a swan as well as your workers there at the same time. So it may be you've got a really good HR contact. It may be a senior manager. It may be another manager. Just make sure that you've got an outlet as well. Please don't take it all over your shoulders and accept that flexibility. You'll come out of this even stronger. So if we go higher up in the organisation, clearly the businesses have all changed at the moment in time, but I found some common things which are working now for businesses, and we've seen disruption in the past. I've taken businesses through disruption. See some of the things which will make the outcome when we get back into it, into the new norm, even better. So from the top down, communicate regularly with your workforce and honestly. If the businesses struggle, tell people, they'll know that. If you're formulating a plan, tell them, ask for their views. But communicate is a thing that you need to do with visibility. You need to be up there and in it. You can still run your town hall meetings through Zoom and other avenues we've got with technology, but let them see you, let them see the human side, let them see your home, let them see you distancing. become part of their everyday life. Make sure that you've got the right technology, the right support, the right security you've got there for that you're doing it to maintain this continuity. You may find that going forward, that part and parcel of your business world, you actually need people from working at home rather than there. Because when we do go back to work, the social distancing that we've got now, I think will become the norm probably right into next year, if not beyond. Handshake, I said, has gone. But even when we're back, this virus isn't suddenly going to disappear. It's going to be around. If we take the lockdown off too quickly, the virus will come back again unless we test, unless we isolate contacts as well. And we don't have the testing at this moment in time. We don't have the antibody testing to test who's had it at the moment, who's immune. Plus, we don't know how long the immunity will last for. So it may well be that the workspace that you've got, you need to have fewer people in at any one time. You might want to have people home working and some working in the office, and you rotate them, etc. You have these one-to-one face meetings with your managers. Cascade it down. Ask how you are, ask the other questions, look at body language. Create this new level of intimacy in terms of working it through your business. Start to be realistic in your goals and your strategy and what your playbook is like for going forward. Be a lot more realistic than what you've been because the world is different. Right the way up and down your supply chain, things are going to change. Start to now look at business continuity planning when we do start up. And I've no idea when that's going to be or how we're going to do it, but it will be on a phased basis. But just assume that that virus is going to be around for a period of time. So it's not just going to be social distancing. We may need to have masks, and the debate is still out about the use of masks, etc. But it may well be if we can't maintain that 6 foot distance, we might have to use masks. And what would that do for communications, etc.? Cleaning processes may be different. Business travel may be different as well at the same time. So start to look at those risks and do some risk management and some continuity planning. But above all, I think at top of your agenda, mental health is going to be there. Wellbeing was starting to creep onto the business agenda. The good businesses were realizing that the mental and physical well-being of employees was vitally important. Good, fit, healthy worker, I'm using health in the generic sense here, is good. But there's going to be economic support for people as well at the same time. There has been changes in terms of furloughs, people being made redundant, people's disposable income will have changed. So your priorities going forward on a people point of view, on a business planning point of view, on a workforce planning point of view, need to be around mental health, economic support, and just general well-being. If you get that right, you will reap dividends in the future. So I'm coming to the end now, and I hope you've all picked up something as we go through that. But I'm going to use a quote now from Charles Darwin. And I'm going to read it out, because sometimes just reading it out helps. It certainly helps me to listen to the words. It is not the strongest of the species that survive, nor the most intelligent, but the one most responsive to change. We are going through change. We need to improve our resilience for now and for the future. Not only going through this, but I think this has been a wake-up call. We will get other viruses, we'll get other hits in terms of planning, business planning, healthcare planning, risk management. This will be the change. But if you as individuals and your families and your businesses look at individual resilience, and that builds up physically, mentally, emotionally, socially, economically, we will get through that. And I will finish this presentation with my famous quote that I live by and promote on every email that I send out for my business. It will be all right in the end. And if it's not all right, then it's not the end. We're going through a pandemic. We're going through a really, really tough time. But we're not at the end yet. I can't know what the end is. Nobody can tell what the end is. There will be an end to this, and we will come through it. So I hope that there's been something in here for everybody. I want you to take out that level of positivity. I want you to take out that belief that we'll get through the most of it. You may find you know somebody who hasn't come through it, and you can be helped through that, etc. But at the end of the day, if you can take something from this and live in a different way, but above all, You can't change the circumstances. As clever as I am, I can't, but we can change our attitudes. So I wish you well. I hope to see you at the other side. And I thank you for your participation and for your listening. So goodbye. Thank you. And I hope to see you again on some other presentations that will be coming from OH1 as we go forward. Please use us as a centre of sensible, scientific-based information. Cheers. Bye.
So that concludes our presentation about health and the COVID-19 pandemic. Thanks for listening. I've been very fortunate to work with David Batman for quite a few years now. I found that alongside his clinical expertise, David has an emotional intelligence that enables him to connect with people and understand each person's unique challenges. I know I've benefited from his counsel over the years, and I hope that you benefit from this advice and you've identified at least one or two changes that will help you get through these difficult times. As always, if you have any questions or comments or you want to get in touch, please don't hesitate. Our contact details should be at the end of this presentation. Okay, thanks again, and as always, stay safe.